Hello. Today we're going to talk about seizures, the care of, the types, and the complications. So what is a seizure? Oh my God. A seizure is a sudden surge of electrical activity in the brain. It affects how a person appears or acts for a short time. They'll have changes in their behavior, their level of consciousness, sensation, and/or motor activity. They can be life-threatening when a condition known as status epilepticus occurs, meaning the seizure will not subside. There's a few types of seizures. There's partial seizures. There's a simple partial, where there's motor and sensory symptoms. And then there's a complex partial. They begin as a simple partial and then they're followed by LOC changes. There's generalized seizures, which include the grand mal, muscle rigidity, eye deviation, incontinence, jerking of muscles, and there's a post-ictal phase afterwards. There's myoclonic seizures, there's clonic seizures, and then there's an absence seizure, which is a sudden loss of awareness. There's also febrile seizures. You can get seizures from hypoglycemia, hypocalcemia, hypoxia, and inborn errors of metabolism. Developmental, traumatic, or vascular abnormalities can also cause seizures. Drug, alcohol, and other toxicologic exposures. Seizures can also be idiopathic. Seizure first aid. Basically, you want to time the seizure. You want to be calm and speak calmly. You don't want to grab the patient or hold on to them. You want to explain to others what's happening and to block hazards all around the patient. Make sure that their airway is kept open and patent, and that basically they're on their side and protected. Seizure care, you want to clear the area of hard or sharp objects. Place something soft and flat under the patient's head. Don't hold the patient down or try to stop the patient's movements. Don't try to force the patient's mouth open or put anything in the mouth. Contrary to popular belief, a person can't swallow the tongue during a seizure. Loosen anything around the patient's neck that might make breathing difficult. Turn the patient onto one side to promote airway clearance. Keep track of how long the seizure lasts, where it started, and whether it changed. Stay with the patient until the seizure ends and that the patient has recovered fully. Do not give the patient anything to eat or drink until fully alert. Call 911 if the seizure lasts longer than 5 minutes. If prescribed, give diazam rectal gel, also known as Diastat. Patients may be on several different maintenance medications for seizures. Some of them include carbamazepine, Tegretol, phenytoin, which is Dilantin, valproic acid or Depakine, oxcarbazepine, can't say it, Trileptal, lamotrigine or Lamictal, gabapentin or Neurontin, topapyramate or Topamax, phenobarbital, and there's several more. These are the ones we most commonly see. Emergency medications include diazepam or Diastat, lorazepam or Ativan, midazolam or Versed, phenytoin or Dilantin, and phenobarbital. Here is just a picture of the patient getting a medication nasally, and then these are Diastat, different containers that you might see in the home, a 10.0 and a 2.5. Generally administered rectally. Alternative treatments include a vagus nerve stimulator. A small battery is implanted subcutaneously and the electrodes are threaded under the skin and attached to the vagus nerve. The caregiver uses a magnet to swipe over the VNS to shorten the time or stop the seizure. Another alternative treatment you may encounter is the ketogenic diet. It's a high-fat, adequate protein, low-carbohydrate diet that is used primarily to treat difficult-to-control epilepsy in children. The diet forces the body to burn fats rather than carbohydrates. This is a little pyramid of the ketogenic diet. At the top, you have water consumption, low amount of carbohydrates, monosaturated and saturated fats, and the largest amount of proteins. CBD oil may be prescribed. We only can administer by the parents. It is not allowed in the state of Connecticut. Some kids are on this, but again, you can put it in the MAR, administered by parents only. Complications that can occur with a seizure is aspiration, injuries, head traumas, fractures, memory loss, violent behavior, status epilepticus, an MI or a myocardial infarction, pulmonary edema, and sudden unexplained death. Thank you very much.